Welcome back. In this video, we are going to discuss about keloid and hypertrophic scar. Let us understand the sites, differential diagnosis and treatment of keloid. What is keloid? It is a benign tumorous growth of a scar tissue and the collagen which is growing outside the boundaries of an initial scar. So guys, you can see here, this is a benign tumorous growth which is growing outside the skin. Why does this benign tumorous growth occur? Initially, what happens if there is any injury, there is production of collagen. This collagen heals the tissue by forming the scar. When there is excessive production of this collagen tissue, when this collagen increases in amount, it results in the excessive scar formation. This excess scar formation is nothing but this keloid. It is extending beyond the skin, beyond the boundaries of an initial scar. You can see more than the normal collagen is formed, it is pushing the scar outside the scar tissue, initial scar tissue. Keloid is common in blacks. It is common in females. Genetically predisposed and often a familial history can also be found. It is very rare in the Caucasians and more in the Africans and blacks. There is a defect in the maturation and stabilization of collagen fibrils. So guys, we saw this collagen is required for healing. So when there is a defect in this maturation and stabilization, rather than the maturation, there is instead excessive production of the collagen fibrils. Then it results in the keloid formation. Now you can see the normal collagen will be absent. What happens here whenever there is a damage? There is depressed scar formation. It is because of the loss of tissues and the collagen which is available in which heals the tissue and forms a depressed scar. Whereas in keloid, what happens? There is raised scar, overgrowth of the collagen. Keloids will continue to grow even after 6 months, or it may even grow for many years. It will extend into the normal adjacent skin. It is more commonly a brownish black or a pinkish black. Why is this pinkish black color found? It is because of the vascularity. If there is vascularity, it is pinkish. And then it is going to be painful, it is tender and sometimes hyperesthetic. What is hyperesthetic? It can feel the normal coldness and heat and everything. It will spread and cause itching. It is very discomfort, causes a lot of discomfort to the patient. It is spreading, it can cause itching as well. So guys, we saw that keloid is spreading to the normal tissues. It is brownish black or pinkish black, painful, hyperesthetic, and we saw that it causes itching as well. This keloid can be associated with Ehlers-Danlos syndrome and also associated with scleroderma, also known as the Ehlers-Danlos syndrome. When the keloid is occurring following an unnoticed trauma or without a scar formation, it is spontaneous keloid. So you have no history of trauma, you have no history of a wound on that particular place for the scar formation to occur. Instead, the keloid is occurring on its own, then it is known as spontaneous keloid. The spontaneous keloids are commonly found in the Negroes, in blacks. Some keloids occasionally become non-progressive after the initial growth. They grow for a period of time and then they cease. The growth occasionally stops after the initial growth. Pathologically, the keloid will contain, what do they contain guys? They have proliferating immature fibroblast. We have proliferating immature blood vessels and the type 3 thick collagen stroma. We have the collagen, excessive production of collagen and fibroblast, immature type and thick collagen stroma of type 3. The site of keloid formation, it is commonly found over the sternum. You can see the keloid on the sternum here. The other sites of keloid formation are the upper arm, chest wall and lower neck in front. In the picture, we see the keloid on the sternum, a butterfly shaped keloid. The sternum is the commonest site for the keloid formation. We also have keloids on the upper part of the arm near the shoulder. Okay, this is near the shoulder and this is a butterfly shaped keloid on the sternum. What are the causes for this keloid to occur? It can occur after burns or an insect bite, tattoos or piercing. The keloids can also form after a skin injury such as acne, chicken pox, vaccination sites, etc. So any type of a minor trauma, any type of a wound or injury results in the keloid formation if it is predisposed to that individual. It also results from scratches, surgical incision sites and also the cuts from shaving. So when the person does shaving, if he undergoes some cut, a minor cut, it can also result in the keloid formation. Differential diagnosis of this keloid we opt to confuse with hypothetical scar or hypertrophied scar in the abdominal. There's a error, okay? It is hypertrophied scar. We don't have hypothetical, it's hypertrophied scar. It is in the abdominal healed wound is given here. This is a picture of a hypertrophied scar in the abdominal healed wound. Now let us see the treatment for keloid. It is quite controversial. We have steroid injections, that is intrakeloidal triamcinolone injection. It is given at regular intervals, that is 7 to 10 days. Of 6 to 8 injections are given. You can see this intrakeloid injection which is given to the keloid so that it reduces. We have triamcinolone reduces the fibroblast proliferation and the collagen synthesis can also be cut down by this triamcinolone injection, and it is the first line of therapy for the keloid. We have methotrexate and vitamin A therapy into the keloid. This is the treatment. Silicone gel sheeting or topical retinoids can also be given. Laser therapy, vitamin E, palm oil massages can be given. Intralesional excision, if it is retaining the scar margin, will prevent the recurrence. Okay, we do the excision. It is ideal and better than just excision. So the intralesional excision is which is retaining the scar margin is good than the complete excision because the recurrences are quite common in surgery. Surgery is not of much help to the people suffering with keloid because there is increased chances of recurrence. Excision and irradiation or irradiation alone can help. Excision, and after excision if we do a skin grafting, that would be much better. Moving on to the second part of the video, that is hypertrophic scar. So the differential diagnosis of a keloid was hypertrophic scar. Now let us see what is this hypertrophic scar and how is it different from the keloid and how can we differentiate these two. Hypertrophic scar can occur anywhere in the body. Whereas keloid we saw most common is side sternum, on the sides of the neck, upper arm, shoulders and so on. Whereas this thing, it is found anywhere in the body. It is not genetically predisposed. It is not familial. Contradictory we had, it was familial and predisposed, that is keloid. Growth usually limits up to 6 months. It is limited to the scar tissue only. So guys, the main difference here comes that, so this is one difference. Second difference, it is keloids are more than 6 months and this is limiting up to 6 months. The most important differentiating factor is the keloids they extend beyond the normal scar. Okay, this is the normal skin tissue, it is extending beyond that. Whereas this hypertrophic scar, it will not extend the normal skin. It does not extend the normal skin. Spontaneous improvement with the time can occur in hypertrophic scar. Now you can see guys in the picture here, this is a linear scar in a clean wound. You can see the clean cut, and this is epidermis, this is the dermis, this is the subcutaneous tissue. It is involving the all the three layers. So we saw epidermis, dermis and subcutaneous in a clean cut, and the clean scar will be formed, it will heal. Now moving on to the hypertrophic scar, it is limiting to the scar. Now you can see this scar, it is limiting to the injury to the scar. Whereas the keloid, it is genetically predisposed, it is also extending the normal skin. You can see this here. Okay. So we saw the difference. What happens in a linear scar, hypertrophic and a keloid scar. In keloid, extending beyond the normal skin. Hypertrophic scar is pale brown in color. You can see the color here. It is pale brown in color. It is not painful. It is not tender. Whereas keloids can be painful. Whereas hypertrophic scar is not painful. It is often self-limiting. It responds well for steroid injections. The recurrence of hypertrophic scar is uncommon. It is common in the wounds crossing tension lines. So where do we find this hypertrophic scars? So when there is very tight suturing done, all the tissues hold on very tightly, tension is created, crossing the tension lines. So what are the wounds crossing tension lines? They're creating the suturing lines, and which is causing the tight tension there, and deep dermal burns, wounds healed by secondary intention. So we have dealt about wounds in detail in the previous video, the healing and everything. So here they're talking about the hypertrophied scar in the abdominal healed wound. Okay, you can see the pale brown color scar, which is self-limiting. What are the complications of this hypertrophic scar? The scar can break repeatedly. If the scar breaks, it can result in infection and pain. After the repeated breakdown, it will turn into Marjolin's ulcer. So guys, you can see here, how does the Marjolin ulcer occurring in case of hypertrophied scar? They have an intact skin, so the person have some initial injury such as a burn or a trauma. Either it can heal completely, or a chronic scar can be formed. The breakdown can occur, and then there is ulcer formation. Even if it is partially healed, it can result in an ulcer formation. This ulcer formation, if it is repeated or not repeated, if this ulceration persists or the repeated ulcers are formed, the repeated ulceration can turn out into the Marjolin's ulcer. Moving on to the treatment, it is controlled by pressure garments. So guys, you can see here, instead of going for surgeries and cauterizations and so on, the pressure garments can give a relief, and often the revision excision of the scar and the closure of the scar, and if required, the skin grafting can be done. Again, we have this triamcinolone injection in the second line of therapy for hypertrophic scar. We had the first line of therapy, that is triamcinolone injection for keloid, but whereas here it is second line of therapy. First we try it by the pressure garments and excision of the scar and the closure of the scar. Excision alone can be done, and we try to close the scar with the skin graft. Now let us see the difference between the keloid and hypertrophic scar. Genetic predisposition. So guys, with this, by the completion of this video, it's kind of very interesting to read the differences, because we know everything, we just have to revise. Genetic predisposition keloids, yes, obviously. In hypertrophic, no. Site of occurrence, we know it's in the chest wall, upper arm, lower neck and ear, and hypertrophic can occur anywhere in the body, commonly the flexor surfaces. The growth, we see it is continuing to grow without the time limit, 6 months and above. Here it is limiting to 6 months. It is extending the normal skin. Hypertrophic is limited to the scar tissue. The treatment, keloids give a very poor response to treatment. Lifelong the people suffer with keloid. They undergo radiation, and then once they do the radiation and try to reduce the size, excise it, and again there is recurrence. So the treatment, they have a very poor response, whereas hypertrophic scar have a good response to the steroids. Recurrence is very high in keloid. Hypertrophic, the recurrence is uncommon. Collagen synthesis is 20 times more than the normal type. We have type 3 thick collagen. Here 3 to 6 times more, and type 3 fine collagen can be seen. Relation of size of injury and lesion, we have no relation with the injury. We saw that some keloids can occur spontaneously. Small healed scar can form a large keloid, whereas in hypertrophic scar, it will be obviously related to the size of injury and the duration of healing. The age, we saw it is occurring in the adolescents and middle age. Hypertrophic is seen in children. Sex, it is common in females, whereas hypertrophic scar is equal in both. So guys, why is it common in females? The keloids can be more seen in females. It is because of the ear piercing, nose piercing, all those types of things. They undergo those procedures, and the recurrence of keloids can be seen in women because of the ear piercing, common in the females. And the race in blacks 50 times more, and there is no racial relation in hypertrophic scar. The structure, you can see the thick collagen with the increased epidermal hyaluronic acid, whereas here we have the fine collagen with the increased alpha actin. What are the features of keloid? We saw the new blood vessels to be formed. It is vascular, it is tender, itching is present, pain is there. Whereas hypertrophic scar, there is no vascularity, it is not painful, no itching is present. Natural history is quite progressive. This hypertrophic scar resolves, it reduces in size, so it shows the regression. The problems, we saw hyperesthesia and ulceration in keloid, and hypertrophic scar not much, but then we saw that ulceration can occur and turn out to be Marjolin's ulcer, but then it's not much seen, but it is more common in the keloids. So guys, with this we come to an end of keloid, hypertrophic scar, the differential diagnosis. Now with this, I hope you'll be able to differentiate this keloid from a hypertrophic scar if any patient comes to your clinic. Okay, I hope everything is clear. With this we come to an end, and if you like my video, hit the like button and subscribe.